Good morning, everyone. It's so great to see so many familiar faces. I see Samantha Dreyer is here. Love Samantha. I also see Chad Pearson's here and Joe Moore. Welcome, everyone. This is a live webinar series, the 12-week point-of-care testing power course. So this is Mastering Respiratory Season for your pharmacy. Today I am welcomed by Warren Dodge of SiteLabs, and we also have Lauren Roby. She is the head of marketing for SiteLabs, and Paige Ralston as well. She is the head of clinical services for SiteLabs. So excited to have everyone here. We want to make this as interactive as possible. So please feel free to drop things in the chat, ask questions. We want to make sure we answer all of your questions and just have fun. So first off, I'd like to know where everyone is coming from. So if you could put that in the chat, let us know where you're located, what pharmacy that you work for, and where you see point of care testing in the future. So of course, that's what we're going to be doing a lot of talking about, but it's going to be way more than just point of care testing as well. So I'm going to go ahead and get started here. So a little bit about me. So my name is Dr. Tara Schneider. I am a pharmacist by background. In 2020, I got really fed up with the way healthcare was, and I opened my own closed-door, non-dispensing pharmacy in Oklahoma City that focused solely on clinical services. So what did this mean? It meant going out and talking to a lot of people about what I should be offering, including physicians. And they said, hey, we really could use some help with point of care testing. And I said, okay, sure, I can figure this out. I want to make this work. I want to help patients in a new and unique way. So I founded TD Pharmacy Services, and my phone started ringing off the hook with people going, hey, we really love what you're doing with point of care testing, but we have no clue how to even start this. So I said, oh, well, this is easy. I wrote down everything that I did, put it all in a package and started consulting with independent pharmacy owners coast to coast on how to implement point of care testing. So what did this mean pharmacies needed? They needed compliance, they needed protocols, they needed help marketing. They really needed just an easy, quick way to get this up and going. So that's where I created my 6-week course to get pharmacies up and going. So beginning of this year, me and my husband, Chuck, we created the Point of Care Testing Institute to break the two apart. So we have POCTi, Point of Care Testing Institute. And, our goal is to help pharmacy owners maximize their profitability and to improve patient outcomes. We want to be the trusted source for pharmacy owners to come to and say, hey, I want to make this a real revenue generating cash service. And so what we do is we help you get up and going in a very short amount of time, using our proven methods that we have done with so many owners coast to coast. And next up is Warren Dodge of SiteLabs. So Warren, would you mind introducing
Excuse me,
yourself?
hi everybody, welcome. Warren Dodge here, and thanks Tara for putting this all together. We're very excited to work with and collaborate the Point of Care Testing Institute, and on behalf of Lauren and Paige and our team, we're just excited to share with you what we do. Just a minute personally, I've spent a long career helping early stage companies grow. And for the last 30 years, that's been in healthcare, working with both providers and pharmacists on strategies for growth. Joined the company a couple of years ago and was excited by an opportunity to work with independent pharmacies. On a small personal note, as a small kid, my mom worked in an independent pharmacy in the town I grew up in. And she was up at the register with the pharmacist in the back, and every day after school, I would go to the pharmacy and get a soda and a candy bar, and that worked until my next dental appointment. And my mom shut that down, but very fond memories of the time I spent as a child going into an independent pharmacy. So at SiteLabs, we have a mission and a vision really around helping making testing easy. And so we've developed tools and programs, and we like to use the term, we're the easy button for testing. And we'll talk a little bit more about that, but we have tools to connect your patient to your pharmacy, so testing is easy and simple for you to implement.
Love that. So today, here are our learning objectives. So these are the things that we want to, cover. We want to help answer any of your questions. So, why should you be offering point of care testing services in your business right now? Why is this important? As we sit here and talk about this, beginning of August, looking at the future, looking through Q3 into Q4, and then also, what are the requirements? I think that this is such a new thing for pharmacists, that they have all these hats that they are trying to wear and juggle and balance. It's like, really, what is required? What do we need to do to get testing? We're going to also talk about tests you should focus on this fall and hit. It's way more than just respiratory. And then, identifying that champion, who's going to drive these clinical services for you. And then how to charge and keep track of your patients. This is where SiteLabs has been instrumental in helping so many pharmacies across the country, as well as creating systems and automation to make this, like Warren said, the easy button. And then the power of marketing your services in your community, which is why we have our marketing expert with us today, Miss Lauren. She's amazing. So if you're new to point of care testing, what is it? So these are tests that are done really quick, typically in 15 minutes or less in the pharmacy, and the results are very easy to read. This doesn't have to be a pharmacist that administers the test. These are tests that, as long as someone is trained to do them, that they can administer them and come up with the result. So according to Deloitte research, point of care testing is predicted to be the second biggest revenue stream for independent pharmacies, right behind filling scripts. So drop it in the chat and tell me what your second biggest revenue stream is right now in your independent pharmacy. So as we look to the future, and say, hey, who's doing point of care testing right now? And some of you might be doing point of care testing. Some of you may be doing, respiratory testing as it comes along. Maybe you were doing COVID testing and doing that really well during the height of COVID. But only 14% of independent pharmacies are doing point of care testing. This is something very new. These are things that patients are looking for. And they're realizing after COVID that independent pharmacies are a great solution for point of care testing. So y'all are here today. You are still early adopters and you're visionaries. So here are some of the irrefutable benefits of doing point of care testing. Of course, there are so many out there. This is the reason why pharmacies want to do it. This can be to generate new cash revenue, increase your revenue for your pharmacy, expand your clinical services because patients are coming and asking for these tests. And another great thing that I love about it personally is there's a low startup cost. When we look at implementing a new service, thinking about what all we could offer, we want to make sure that these are as inexpensive as possible, quick to do, easy to get off the ground. It's kind of like what I say is, if I tell you that you need to go and fill 20 more scripts a day, would you do it? Absolutely. If I tell you you need to go and do 20 tests a day, would you do it? It's the same exact principle. So here are some of the other benefits of doing point of care testing in your pharmacy. This is revenue that PBMs cannot touch. We're talking cash revenue. We're talking beating your competitors on price. Even with a profit margin of 50%, that's very desirable. That's, right up there with supplements. A lot of the times what we package for our clients, their profit margins are 70% or better. And then, a lot of pharmacies are looking to increase their physician relationships, be at that same stature as the physicians, and increase those partnerships. So this is, really important. Point of care testing for me personally in my pharmacy. I create a lot of physician relationships and nurtured those relationships through doing point of care testing, helping their parents, helping their children, helping even the physicians themselves get testing that they wanted to have done that they weren't able to do themselves or weren't able to do in the health system. One of my favorite things about this all is that the pharmacist doesn't have to drive it. This doesn't have to be you wearing one more hat saying, oh gosh, I have to now do point of care testing on top of everything else. This is why you could delegate this, train a technician, train a cashier, train a clerk, even a delivery driver can do point of care testing. They just have to be trained. So what are the requirements for doing this successfully? It takes, getting a CLIA waiver. This is, Paige helps pharmacy owners all the time get their CLIA waivers done, get them submitted and get them back. So now, since the pandemic is officially over, if you're looking to get your CLIA waiver, you would have to, of course, wait. But usually that's only a few weeks is what I've been experiencing right now, which is why if you don't have a CLIA waiver right now is the time to submit that to your state to get that back. And you also need a champion who's passionate about providing clinical services. And it's okay if it's you as an owner or as the pharmacist. That was my passion. I said, hey, I want to do this myself because I want to be able to help people in a new and unique way. But you might find that you have a technician or a clerk that says, hey, I want to do more than just fill prescriptions. What else can I do? The employee engagement piece of this is so important for retention in your pharmacy as well. And then the other things that, that we provide, POCTi provides, SiteLab provides, are listed here below. Marketing. I know that there's so many of you who are such busy owners and you're like, hey, I'm struggling with marketing. This is just one more hat that I need to wear. That's where we come in and we're going to be able to help out. Ongoing compliance. We have a whole course over compliance. Policies and procedures, things that are already done for you. Automation, love automation. It takes away a lot of the paperwork out of your day. But one of the bigger things that I find that people, pharmacy owners are really needing and struggling with is the accountability piece. Someone who says, hey, take my hand and lead me through and tell me exactly what I need to do. I want to do this. I'm ready to do it. Just tell me where to go. And that's where our training is so beneficial. And then speaking of a champion, you can go to www.poct.co and download the championship checklist. So these are the traits that make a great champion for your point of care testing services. So I recommend everyone going and doing that, and you'll get the PDF copy immediately. But, someone who has an outgoing personality, someone who can come into the pharmacy and talk to patients and go, hey, here's why I think you need this. Someone who has really great communication skills. This person needs to be able to communicate to the patient their test results, what they should do next, how to sign up for testing. This should come naturally to them. That's why I think cashiers do such a great job at this, because they do have great communication skills. They are the person who is front facing for your pharmacy, and organization skills just to keep everything organized from the test to the results. And then someone who's clinically oriented. That doesn't mean they have to be trained clinically, but this person should show interest in developing these skills. So, point of care testing, it's like I said earlier, it's more than just flu and strep. Although that's what we will be concentrating on in the first 4 weeks of our course. We do want to make you interested in some advanced point of care testing as well. You might say, hey, respiratory is cool, but I'm really interested in doing chronic care testing, A1C, lipids, maybe HIV. PrEP drugs are becoming more and more prevalent. Patients are asking for them. You're probably filling PrEP drugs. You might even be in a state where there are protocols for PrEP. So, doing the testing up front, and then doing the recommended testing every month as well in your pharmacy. These are really great clinical services that you can bring that are going to help a whole lot of people.
Yeah. So, one of the challenges, not challenges, but opportunities in providing point of care testing is how do you connect and engage with your patient? And that's where SiteLabs has created a tool, a platform, a software tool, software as a service to make it easy. So very simply, after about 20 minutes of registration on your side, you're provided a link that you can put on your website where the patient can click. The patient will then select the test that they want to take. They'll schedule an appointment. They'll pay for the test. All the pricing is specific to what you choose to charge. They do all the necessary consenting. And here's the really powerful part. When they arrive at the pharmacy, all the paperwork is done. They simply check in, you confirm you have the right patient. You do the, collect the sample. Maybe it's a nasal swab or a throat swab. And once you've collected the sample, the patient can actually go home. You then result the test. Maybe it's a simple antigen test. And once the test results, you enter it back into the software. From a smart device, you take a picture of the test kit, and the system then automatically sends the results to the patient. And again, you're done. So the patient, again, they do everything on the website, paperwork's done. When they arrive, you collect the sample, result the test, enter the results, and that gets sent back to the patient. If your patients tend to engage as a walk-in, you can also do that for walk-in patients. So they can enter the pharmacy, they can scan a QR code, your front desk person could also enter their information. So it works beautifully online. It also works very elegantly for walk-in patients.
Thanks for that, Warren. So as we look behind to look ahead, why we're saying, hey, jump on Respiratory right now, get this up and going. If anyone remembers last year, which I know that the SiteLabs crew remembers very, very well, in 2022, early October, we hit a spike in flu cases. We hit a spike in respiratory testing. People couldn't find respiratory testing. There wasn't any available. We had the most severe flu season that we had seen in 13 years, and it happened early. So this is the time to jump on it right now, because this is what we're looking at for 2023 as we flash forward. So we always look at what's going to happen or what's happening in Australia to see what's going to happen in the Northern Hemisphere once we hit winter. Australia is already having a very intense flu season, and they're having a record number of flu cases, especially in young children. So this is why it's important to, get the word out now that you are offering testing, because if what's happening in Australia happens here in the United States, which is very likely, we're going to be running into a shortage of tests again, and people who are able to provide tests. So patients are going to come to you and look for you for their testing partner.
So as I mentioned a moment ago, here's an example. If you look on the left of your screen for a Magnolia Pharmacy, where the link has been added to the website. And you can design the link to say whatever you want. In this case, this pharmacy has said COVID, flu, and strep testing appointments, and that is where the patient simply clicks. And what the patient gets after they've registered and the test has been resulted is an encrypted link sent via email and or text based on how they registered with that test result. So on the right here, you can see what the result looks like. So it has the name of your pharmacy, the type of test, the test results, all the different ways that a patient might need to consume the test. And we'll have the ability to send that via secure fax directly to the patient's provider if they wish to have that done.
Yeah, so, we think about automation, we think about scheduling, which SiteLabs does so well. So here are my 4 C's of scheduling. First, to make this run very smoothly is you need a calendar link, like Lauren said. Here we go, we're going to click on this link, we're going to be able to see who's available. This is also important for your staffing as well. You could say, okay, well, Shelly is available these days to do testing. We're going to open up at these time slots, and then collecting payment. It's important that you collect your payment up front for the time that the patients have chosen to come in. And you also want compliance. We think about data breaches. You want to make sure that the software you're using to collect patient information is HIPAA compliant. And a great way, like Lauren said, to communicate it back to your patient, get them their results they need, get the communication to the physician or back to the patient so they can get the treatment that they need and get on down the line.
So marketing is obviously my favorite part about this program because I feel like it's so critical to the success of any onboarding of a new software or a new offering in your business. And a couple of things that we really want to highlight through this course is the power of social media. I know it's easy to think that maybe Facebook and Instagram, oh, it's for the young kids, but for businesses, it is so powerful, especially when you're talking about knowing who your target audience is, the families that are coming into your pharmacy. There's so much power in that, and that's something we definitely want to highlight in this course. Also, your website. We talk about having the link on your website to schedule your point of care testing, but there are so many more things you can do to make your website more robust, make it easy and user-friendly. As I say, so easy your grandma can do it, and make sure your branding and messaging is clear and consistent throughout. And then lastly, the referrals and reviews. This will kind of be on the tail end of the program, but it is so critical as a piece of marketing just to make sure that you are building that trust in your pharmacy. And that's the great part of being an independent pharmacy. So many of these pharmacists we speak to, they know their customers, they know the name of their dogs, they get invited to their customers' ballet recitals, and that connection is so critical. And we just want to help give you guys tools to expand that even further and really grow the loyalty in your program. So marketing is very exciting, and we're looking forward to diving deeper into that with you guys.
Yeah,
I'm going to jump in and add what we also do is provide you with some of the graphics and memes that you can actually use in social. So, not everybody has Lauren's graphic design expertise. So we provide you with some of those, images for the flu season and images for the holiday season that you can very simply kind of drag and drop into your social media platform, and then add the text that makes sense for your pharmacy.
Yeah. And, if y'all are using social media, drop it in the chat. Let us know your social links, what you're using. Are you using Facebook, Instagram, Google? I mean, Google is huge. People forget about their Google business. So let us know what you're using. TikTok. There's so many options out there nowadays. Where are your patients hanging out?
Tara, now that Twitter is X, do you say you're Xing something versus tweeting something? I'm not sure.
I don't know. Let's ask Lauren.
I'm not ready for that yet.
Right.
She says I'm not accepting it.
Yeah.
Oh, so let's talk turkey here. Let's talk numbers. I think this is so important as you look at developing a new service. You're a busy business owner. Why should you do this? Do the numbers make sense? What is the ROI? So if you're like most independent pharmacy owners, 91% of your income is coming from dispensing drugs. As we look forward to 2024, we know that this will cause pharmacies to pay double DIR fees. So, this is the squeeze. This is where pharmacies are really starting to get squeezed in the DIR fees. So here's some very interesting statistics from NCPA and Drug Topics. So between 2010 and 2019, DIR fees increased by almost 100,000%. Like, I can't even fathom 100,000%. So I put it into context for you for a gallon of milk. So a $4 gallon of milk, that's a tongue twister, was increased by this much. It would cost you $3,660 for a gallon of milk. So this is why it's so important for pharmacies. And I know you all know this. This is why you're here, to look at what you can do outside of dispensing for revenue. So what we recommend at POCTi is that your non-dispensing revenue must be at least 30%. This is the KPI that we set for our pharmacies. A lot of them are up at maybe 15 to 20. Some of them are in that 91% of, hey, this is my main thing. My main thing is dispensing medication. And so we set realistic goals with our clients over 90 days to get them here. So let's look at the ecosystem. What does this look like? So you look at the PBM ecosystem. This is so convoluted. Like, where is all the money going? Where does it flow? How does it get to the pharmacy? As you can see, the money from the patient back over to the PBM, it goes everywhere else pretty much, but a very small amount will trickle down to the pharmacy. And if you think you're getting great manufacturer rebates, I promise you, you're not. That money is a very small amount compared to where else it might go back to the wholesaler. So we know this. We know that this is not transparent at all. So that's why we've created a much better model for pharmacies. This is the POCT ecosystem. This is the test, the therapy, retest model that we teach at POCT. So as you can see here, the lines are much easier to read. We know where the dollars are flowing. And this helps you close the loop in your pharmacy to get the patients the care that they really need at a great price point. So we help you partner with physicians to get the patients the consult, to help you with the positive tests that you might have, to get the prescription, to get the OTC pills. All that money is coming back to the pharmacy. You can easily have a patient come in, do a test with you, see a physician, get a script, walk out with some OTCs or some supplements and be on their way, instead of going around town all day trying to figure out what clinic can I go see, where could I get a test, now I got to get my script filled. And they've spent a whole day doing this. You can do all of this in your pharmacy in an hour. So, pharmacists are the most trusted healthcare provider, and that is for a reason. Patients see their pharmacist 8 times more frequently than they do their primary care physician. Think about your pharmacy, your patients. Like Lauren said earlier, there's so many of your patients that personally. They come in, they might not even really need a prescription filled. They might just stop by and say hello, because they trust you. You are that partner in their community, and they're looking for services from you. They want more from you. If you said, hey, we're offering testing. If you get sick, our loved one gets sick, come to us, we'll take care of you. And they're going to say, yeah, I know you would. So you just have to offer those services. So, getting back to some of the numbers. So here is a pro forma for point of care testing. So if you were just to do testing only and say that you saw 5 patients per day, So you are open, 20 days on average a month. That's 100 tests. And as you can see here, at a 70% gross profit margin, the numbers are great. What could you do with $7,000 more in profit? We're not talking revenue, we're talking profit per month. Drop it in the chat what you would do with $7,000 in incremental profit per month. And as you can see down here, packaging these tests with your COVID, flu, RSV, and strep for $100, you're going to beat the price points of many of the box stores who are attempting to offer testing. That's your CVS, Walgreens. They are charging. CVS was actually the lowest at $225. So, you're going to be able to beat that. You're going to also be able to help so many of your patients who have high copay deductibles. This is going to be much cheaper than going to an urgent care. And they can, come see you and get everything taken care of much faster. So, as we talked about earlier, we kind of teased our test therapy retest model. Adding supplements, adding those OTC cells when patients come in, because it's more than just a test that they need. They come in, they're not feeling that great. What else can you offer? You have solutions right there in your pharmacy. Can they walk out with a bottle of Dayquil, NyQuil? Maybe they need a good multivitamin, some vitamin C, some zinc. Maybe they need some, decongestant medication. What else could you offer them in, 1 minute? Just say, hey, what are your symptoms? What are you experiencing? Here's what here's something that will help you. And, just by having that small conversation with your patients, that can produce an extra $1,000 in revenue per month. So this gets back, as I said earlier, into our model of test, therapy, retest, because there's so many things you can offer patients year long. Point of care testing shouldn't be something that you just focus on and concentrate on in the fall. Your patients are wanting services all year long that you can provide. They want to see you as their healthcare provider and that person in their community they can trust, that they can come talk to. The average patient has 3 to 5 minutes with a PCP. They aren't getting counseling on their lipids. They're not getting counseling on their A1C. They might not even be getting these things looked at. So this is where you can come in and provide a great deal of value. So, there's two ways that, you can go about doing this. You can choose to create it alone or join us and the team and create it together. We really hope that you see the value in this, want to create it together. And then, one of the things that pharmacies ask us is like, how much time commitment do I, need to put into this? I'm, busy owner, I'm hiring people, I'm, trying to do a lot of things. So, this is really what you need to bring. If you look on the left side of your screen, just a desire to increase your revenue. You want to expand your clinical services. The commitment to us is, attend weekly calls or watch the replay just to stay on track. There will be assignments and things, of course, that you have to do, and we'll be very directive in that. This is a way that we will hold your hand and get you up and going and carry you through for 12 weeks because we want to see you be very profitable. And then a desire to make really great money over a 10-week span as you get these services up and going, as we look to what's going to be happening with respiratory season. And then over here are things that POCTi and SiteLabs will help you with. We want to be your partner in point of care testing. There's a lot of automations, results reporting. We're going to bring you, vetted partners, exactly what tests you should be offering, telehealth solutions. There's also a lot of online learning protocols. We're going to help you with your store's KPIs as well. So here are a few, case studies. So we had a client in central New Jersey who said, hey, I want to make point of care testing a priority for me. And this was in the wintertime, well, maybe like late fall. And I said, okay, yeah, let's do it. Let's get you up and going. In 1 month, this pharmacy was able to generate $50,000 in revenue just from COVID testing alone. And this, this gave this pharmacy $35,000 in profit. They were a brand new pharmacy. They said, hey, we have the time to do this. We're committed to doing this, where we want to make this a priority. So now they are a testing partner in their community. People started looking to them for, hey, what more can you offer? What else can you bring? And so they constantly generate a really great profit off of their testing. Here are a few examples of pharmacy owners that we have helped as well. Some pharmacists, they needed help with automation. Marketing is another thing. Some pharmacists said, hey, I want to retain my employees. This is a great thing for them. This is something that I know will help my community. And it's that employee engagement as well that was able to help Shelley keep some of her employees engaged and doing things beyond just filling scripts. Another one of our clients, Amanda, we were able to help her decide on who her ideal client was. Who does she want to target? Who does she really want to work with, and bringing her passions with point of care testing. And she found out, it was more hormones. That's really where she found her niche and her passion. So we were able to do that with her and help her streamline her services. And then here's some examples of SiteLabs that Lauren might want to talk about.
Yeah, Tara, we had similar experience. We launched our company 2 years ago. We're a testing company. We launched during a COVID pandemic, and, kind of a blessing is a curse, maybe, is for all of you. It drove a lot of interest around testing, lots of patients looking for testing. Excuse me. But we just had tremendous uptake, and the same kind of experience here. Pharmacies getting lots of new patients, high margin revenue, patients willing and wanting to pay cash, and not having to bill insurance, and no clawbacks and no fees. And again, very similar outcome for our pharmacy customers as well. Hundreds of new patients, tens of thousands of dollars in profit. I think the one thing you'll see if you read the comments here from our customers, it's just not that hard. It's easy. That's kind of the common theme when people talk about their SiteLabs experience. It's not that hard to do. The tools make it reasonable and easy.
Yeah, I love that. So, here's what to bring to the table. You as a pharmacy owner, as a business owner, it's commitment to making this a new clinical service for your pharmacy and your community, showing up to calls, watching the replays, being engaged in the 12-week course. You'll have a mastermind of people there to help you. And then finding that champion, who's that person that's going to be owning these services? Who's that person that's going to help drive it? And then from POCTi and SiteLabs, here's all the things that we're going to bring, that accountability to say, okay, hey, let's get this done this week. Here's, 3 tasks that we want you to do. And maybe they take 20 minutes, maybe they take 1 hour to do them all, but it's very, very short things that you'll need to do. We provide that support. We're here for you. You say, hey, I'm struggling with this. You'll have our email addresses. You'll be able to send us an email, and then also communicate back with the group and say, hey, what did y'all do? How did you do this? How were you successful? And then setting goals. I think it's so important that, as a business owner, you set goals and KPIs for your team. You're the leader. You put that up on the board and say, hey, every day, this is what we want to do. We want to talk to people about point of care testing. How many people did you talk to today? Did you put that bag stuffer on that prescription to let people know about our services? Because it's so important to, getting the word out. As Lauren mentioned earlier, the marketing piece, and we're going to help with the implementation and workflow. That's where SiteLabs has, created so many great solutions. They have the test, they have the platform, they are the easy button in that piece. So everyone, this is your official invitation to our 12-week point of care power course, Mastering Respiratory Season in Your Pharmacy. This will start in 2 weeks on August 16th and run through November 1st. And Lauren is going to drop the link in the chat here in just a minute. But this is the roadmap. We want to show you what this is going to look like for you as an owner. What will you be getting out of this course? What are you going to learn? So the first 4 weeks, we're going to help you launch respiratory testing. Why is this important? Like I said earlier, if the same things that happened last year happen this year, you want to be on top of this in September. More importantly, many of you do vaccines. This is a time to talk to your patients about what other services that you offer, including point of care testing. Have that up and ready. So, when you do a vaccine, you talk to a patient, you have 15-minute dwell time. What are you doing during that 15 minutes? This is one thing that you could talk to your patients about and just say, hey, we're offering point of care testing services. This is what we're doing right now. We're looking to expand, get some feedback as well. The more people you tell about your services, the more likely they are to tell other people what you're doing. So, this is our weekly schedule for the first 4 weeks. If you don't have a CLIA waiver, no worries. We're going to help you get that going. We're also going to talk about, compliance, workflow setup, where to source tests. That's SiteLabs. SiteLabs will talk to you about their tests and their options that they have, how that all works, making sure you're getting set up with that. In week 4, if we haven't already identified our champion, we're going to find that person. We're going to talk a lot about marketing, talk a lot about KPIs. And then if you see at the bottom, industry expert calls. So every week we're going to be bringing you industry experts that are in testing, but maybe not necessarily respiratory testing. And they can also help provide solutions for your pharmacy to pique your interest for finding that niche. What do you want to bring to your community? What does your community need? And then our next 8 weeks is really the more advanced point of care testing, really going beyond just respiratory testing that you can offer to create a game plan for what you're going to do year round in your pharmacy. So week 5, this will be early September. So we'll be talking about vaccine clinic magic, what you should be offering at vaccine clinics, what should be talking about. And then these patients, creating an immune boost protocol and letting them know, like, hey, I want to help you stay well this season. And then we're going to get into marketing 102 with Lauren. As she helps you walk through, who's your ideal client, where are you going to target, and then demystifying social media, because I feel like as an owner myself, as a business owner, social media can be a struggle. So Lauren is going to come in and help us, with that, and then beyond just respiratory, talking about point of cell testing. So what tests can you offer year round to your patients? And then getting into some of the chronic care management. I know there's many of you who are interested in doing, things year round, maybe working with physicians in their offices. Maybe you're in a medical desert and your patients don't have access to really great A1C, glucose, lipid testing. You can be that partner in that community and work with physicians to make sure these patients are getting tested. Week 9, we'll go into cholesterol, In week 10, talking about supplement cells, as we mentioned earlier, this is a big part of your front end as a pharmacy owner, boosting those supplement cells, having those conversations. We have many talk tracks that will also go over on how to increase those cells and get your patients what they're looking for. Patients really don't know what it is that they might need, and they're going to be looking to you as that medication expert to say, hey, here's what you should be taking. And also testing for nutrient depletion. This is so important as we think about omegas, vitamin D, B12. There's so many things that we are deficient in, and we don't even know it because physicians don't have the time to test you and make the follow-up, but you as a pharmacist, you absolutely do. And then week 11, we'll get into HIV testing. There are more and more states that have protocols for HIV testing. And I know that this is a hot topic. People would love to offer this, but it's, that compliance consideration. It's the test kit option. It's how to do it, how to partner with the people in your community to get that testing done. And then in week 12, after you've taken in this 11 weeks of all this information, looking at going to the next step, creating a membership model. I know so many pharmacies would absolutely love to do this, but it's what should I offer in my membership model? What is my niche? We're going to be talking about testing that you should offer every single day of the year. And so with that, this, like we said earlier, this is, an invitation to join us. This course is valued at easily over $3,000. And here's everything you're going to get. In addition to what we just talked about for those 12 weeks, you will get access to the on-demand learning, many protocols. We'll have multiple weeks coaching calls. So there's a lot of information that will be coming at you, industry experts. So we're going to bring you the best in the business to talk to you about what you should be offering, supplements as well as testing, and then also support for your pharmacy. This will all be recorded. So if you say, hey, this might not be the right time of day for me, some days of the week, hey, you'll get the replay. You'll be able to watch those things back. And Lauren, will you talk about a little bit about your marketing?
Yeah, we want to provide as many tools as possible to set you up for success, because what good is the program if the patients aren't coming in to get the testing? So part of the marketing is helping you just kind of increase your traffic for new patients coming in, as well as with your retention and loyalty with the patients that you already have. So we're going to set you up with numerous different tools throughout the course. As Tara mentioned, that's going to be social media. That's going to be any sort of outbound communications like your newsletters or email templates that are going out. And just making sure that your branding is exactly how you would want it to be to help grow your program as well.
Yeah. And let me see here. Yes. So, we appreciate everyone coming on today, and we're going to be answering any questions that are in the chat. But as a special offer for coming today, we are offering you 50% off of our already discounted 12-week program. So you can either scan this QR code or go to the website at the very top. There is a link to join and use the code 50 off at checkout. And that will get you 50% off for the 3 months of the course. So I would like to see if anyone has any questions. Lauren, did you see any questions that I need to answer right away?
It looks like one of our guests had a question about patients in Oregon and specifics about that.
Okay, let me see here.
That was from Mr. Wade.
Mr. Wade, okay. Okay, oh, there we go, okay. So Wade asked, does either company have members in Oregon? There are some challenges for our pharmacy running with this here. So Wade, yes, I do have a client who is multi-store owner in both Oregon and Idaho. And yes, I am aware of some of the challenges that you're facing in Oregon versus your neighboring states. I would be happy to, jump on a call or answer any questions you might have about that. But is it doable? Absolutely. It is doable in Oregon to do point of care testing.
Tara, there's a question from Samantha. Is there an additional fee to the patient for the telehealth consult, or does the $99 include that?
Great question, Sam. So it is additional fee for the telehealth consult. What we recommend our pharmacies do is, do the test. So if someone isn't feeling well, get the test done. And then from there, you see if they need that consult. Instead of, maybe working it the other way around. If they do, they might have a physician that they want you to send those results to. You're going to be a lot cheaper on doing a telehealth consult in the pharmacy than them trying to go to an urgent care, get an appointment there. Testing at urgent care is probably 3 times that 99 is probably closer to doing all 4 of those tests would cost around $300 or more at an urgent care plus your urgent care visit. The companies that we've worked with have been really competitive on the pricing for an urgent care visit. And, it's that convenience factor as well, that patient can come to your pharmacy, get the testing done. If they're positive, say, okay, here's $60 more you need to spend to do a telehealth visit.
Similar question from Tony Cambridge. What happens when a result needs further consultation? Where is the patient sent? Are the test results used or related dismissed? Are the limitations fully understood?
Yeah, no, that's a great question. So, kind of getting back to what I was talking about, answering Sam's question, it's an opportunity to say, hey, here's your options. You can, obviously with SiteLabs platform, you can fax that over to a primary care, give them a call, say, hey, we have a positive result. And, this allows you to have that conversation with that physician's office as well and say, hey, we're offering, point of care testing. It also gives you the ability to do a telehealth consult with a physician that you would, partner with, or companies that we work closely with, that you could, bring into that clinic, say, hey, Mrs. Jones has a positive flu. She needs Tamiflu, and then that physician can see the patient and if indicated, get them Tamiflu. And then, of course, there are limitations. I mean, patients have the right to say, hey, I don't want anything. I have the flu. I'm going to sit back and just deal with it. I don't want Tamiflu. Maybe they've had, medication before and they said, I don't really want to do that. Patients have the right, but, for you, documenting what you've done, what you've said, hey, I recommended Mrs. Jones go on and, either see a telehealth or, see her physician and let them know that they're positive. And you always have the ability to print that off and send it with them as well. If they say, yeah, hey, I'm going to go, check out the urgent care down the street instead of doing a telehealth visit here, print that off and send that with them. So, those are, the opportunities. And as more states start getting test and treat opportunities, and more protocols are being made for states, I see that eventually, for respiratory testing, I talked to a lot of physicians about this, and they're like, they want pharmacies to own this. They say, okay, you guys are the medication expert. You can easily do a test and get treatment for a patient following a protocol, and this keeps people out of the ERs, keeps health systems from being overwhelmed, doctors' offices from being overwhelmed, just having those pharmacies. So there's a lot of other healthcare professionals that believe in us and say, hey, we know you're the medication expert. We want you to own this. So I see over this next year, more and more states being able to do test and treat.
Tara, there's a question from Rocky. What point of care testing devices are being used for pharmacies for respiratory, e.g. for flu testing?
Yeah, Warren, do you want to take that? What options y'all have?
I'm going to ask Paige to respond to this question. Paige?
Sure. So for flu testing, we have the status flu AB test that's point of care. And then we also carry the status COVID flu AB combination test. So those are the two tests we recommend.
Are those an antigen? What's the actual device, or the how's that done, Paige?
Sure, it's they're both rapid antigen, no actual device required. It's the test cassette that would be disposed after the patient's tested.
Great, thank you. And a question from David Freestone. With the end of the public health emergency, do you foresee additional changes, i.e. scaling back of abilities of pharmacies to test moving forward?
I don't. I think that, as I mentioned earlier, I see this being a big opportunity, because what physicians have seen, what the public has seen is, hey, pharmacies can do testing. They could do COVID testing, and then we got our test and treat protocols, right? We had RegenCove, the first one that came out in 2021. It's like, hey, pharmacists have this ability to do this, and we did it really well. We were able to roll out vaccines. We were able to roll out point of care testing. And now, they're looking to us to go, hey, can you help us solve other problems like HIV? That's why we're going to have a whole week dedicated to HIV testing, because I see this being the next national protocol that we are going to get, is the ability to test and treat for HIV. So there'll be more and more opportunities, because as our patients grow older, as we have more and more people here in the United States, and we don't have the nurses, we don't have the physicians, we don't even, y'all know this, we don't even really have the pharmacists. We have to look at every single resource we have available to help us with these, what I call low-hanging fruit tests. So, I think that the federal government is going to look to us as pharmacists and look to us as independent pharmacists and go, hey, can you help us solve this problem of all these patients coming into our emergency rooms, overwhelming our health system? Can you do the testing and the treat?
Right.
Can you help us with HIV? I mean, it just goes on and on what pharmacists are going to be able to help with, because we're trained. We are very knowledgeable in this.
Here, I know we're running out of time here. I just want one parting thought. Many of the people watching this webinar will have done this via the recording, right? Not everybody who sees this will be live. So just a shout out to everybody who's watching this, not live, but through the recording, and an extra shout out to all of you who are attending the Diversify RX Pharmacy Profit Summit. It's a great conference. I was at the last one. I wish I was at this one. So just one last thought. I don't know if any of you are hockey fans, but many people, not all, think that Wayne Gretzky was the greatest hockey player of all time. And on another call, we can debate whether that's right. But when asked, why was he better than everybody else? Wayne Gretzky famously said, I skate to where the puck's going to be, not where it is or where it's been. So I challenge all of you to think about, where is your pharmacy puck going to be in 3 years? Is it simply filling prescriptions, or will it include additional clinical services like point-of-care testing? And the challenge is, you have to start. Start now, join the Powerhouse program, but you have to start, because in 3 years, 4 years, 5 years, when clinical services are an increasingly large part of your business, you'll thank yourself for making that first step. And the program that Tara has put together, and the tools that we at SiteLabs provide, make it really simple. We have your back, we'll help you, we'll support you. So start now. You just have to start.
It's great advice, Warren. You're exactly right. I'm so glad I started when I did, because as you know, respiratory season rolled around, as COVID, waxed and waned. I was ready. I had the word out in my community. People knew that I was the person to come to, and then they started asking, what else could I do? And so it was a very serendipitous thing that I incorporated point of care testing into my pharmacy, and and now I'm able to help so many people. So yes, thank you all for being here. We hope to see you in the 12-week program. And if you have any questions, please feel free to email me, Tara at POCT.co. You can also find my information on the website. And Warren, you want to share your contact information?
Yep.
There you go. Well, thank you all for attending, and we will get this replay out to everyone as soon as it's edited. Have a great day, everyone.
Thanks all. Appreciate it.
Thank you all.